Hi, I'm Dr. David Lunt. A lot of people call me Ray, which is the name I was known as at birth, but my first name happens to be David. I've had 66 years since I qualified as a Royal Association lifesaver as a schoolboy, 15 years old, and very enjoyably I've continued to write exams, pass them, and uh, now in lockdown, wondering what I've learned and what I can pass on to other people. In 1983, I diagnosed HIV patient when there were less than a handful known in the UK. Went back out to South Africa, where there in my first year as a registrar, I was in charge of the figures for Cape Town, and there were less than 10 AIDS cases and 10 times as many HIV positive cases, and we were trying to find out which ones were true cases and which ones were not true cases, because people, once they were given the diagnosis, wanted to have it verified, and the easiest way of doing that was to go and donate blood, which was a tremendous problem for everybody trying to screen those people out of it. Since then, as you know, millions of people have died from HIV/AIDS and still continue to do so throughout the world. Luckily, some manage to live with AIDS, but at the expense of medication and quality of life. We now have had this COVID epidemic, which turned into a pandemic, and which I am in lockdown for at the moment because of my age. So I'd like to communicate some of the understanding which I have achieved of these viral epidemics and pandemics. While I was in Cape Town, we had a viral hemorrhagic fever outbreak, which was contained very quickly. And the reason we contained it very quickly because people died very quickly. They had 4 days to live from the time of catching it, and that was shocking because one of our professors died, and all he had done was touch the notes of the patient who was in full barrier nursing, and he wanted to read the notes from a previous doctor, and he asked them to pass through to him. He passed and he touched it. It was the only contact he had. So there are very dangerous viruses out there, and we've got to learn to cope with them. In 16 years ago, at the World Police Medical Officers Conference in Dunblane, Scotland, I presented on biocrimes and the dangers of viruses outbreaks for the whole of our world. Not just us, we need to be prepared for them, and this one seems to have caught us completely off guard. 500,000 deaths throughout the world within the first 6 months, and it's going to be with us for a long time unless we learn to understand it properly. So let's just start with trying to get a bit of understanding about how this particular one and other viruses, which are respiratory viruses, also work. Once you inhale the virus, and it has to be an infective dose, it gets down into the alveoli. The alveoli goes through your nose, mouth, larynx, trachea, bronchioles, and eventually down to alveoli. And if you were to look at a bunch of grapes like this, you could imagine those being squashed together as alveoli. And the stalks which are holding them is the respiratory tree, which is coming up. Now, for a virus to get out of one alveoli into the next one, because they're not motile organisms, they get blown along or wafted along by the air. So this alveoli has to squeeze in expiration to push it out up the bronchial tree, and then during inspiration it will move out of the bronchial tree back into another alveoli so it can spread. And eventually, as it spreads, It will not just be the alveoli, but it will be sections of groups of alveoli, and eventually it can end up into a lobar pneumonia, and at a stage after that it becomes sepsis quite frequently, even before that, and that is more likely to not to be terminal for the patient. So we need to understand, and we need to do more than just diagnose. We need to kill this virus, and so far we have not been looking at that. I want to now look more at what we can do about killing this virus. So if we were to look now at a single grape, which would be the alveolus, there has an area in it, angiotensin type 2 receptors in the inside, and that is what the virus attaches to. And the virus attaches to that very strongly. And because it is strongly attached to that, that is why we've had such a lot of trouble getting rid of it. Okay, but it can be broken, and that will come onto management, which I'll talk about later on. And by breaking that link to the alveoli and making the virus impossible to attach, that would be a good way, which I propose, for killing it off, even at that very initial level at the alveolus itself. Now once it gets into the alveolus, this is a type 2 alveolar cell, the type 2 alveolar cell. It can attach to and can start to replicate within there using the host DNA, or this is particularly an RNA virus, to produce proteins, lipids, and all the things which are necessary for it to grow. Eventually, it kills off the cell, and then a whole lot of viral particles are released, and when they are released, they also have destroyed that type 2 alveolar cell, and that type 2 alveolar cell also produces surfactant. And surfactant is what you use when you want to blow bubbles with soap. It's on the outside of the alveoli to enable the alveoli to expand without a lot of pressure. If it is absent, the alveoli just collapses. Now that's what the virus wants. It wants the alveoli to collapse, to squeeze out into the bronchial tree and then come down again. Now the natural occurrence in a child is they've got a smaller lungs and surface area, so it doesn't have to travel very far before it is out into the atmosphere. So the child does not get the same amount of exposure and reinfection from into other alveoli around it. An adult, and particularly the elderly, have now got a decreased immune system as well, sure, but they also have got a much bigger load, because that comes out into the atmosphere, and if that's coughed out, then that is how the virus spreads. So if we talk about spread for a moment, that's one of the ways. By decreasing spread, you kill off the alveoli, the virus, and that is why we've got this emphasis on personal protective equipment, which we use, which are face masks. And face masks, as you can see, demonstrated there by the presents dust particles or getting in. Now, viruses are small. They are filter-passing organisms, and that is what the original definition of a virus was, a filter-passing organism. So although you're wearing a face mask or a cloth covering, you will decrease the amount of virus which you're breathing in from somebody else. And so you will spread less of the virus around. And that's why we must obey what everybody has said and wear face masks wherever possible. There's only one time where a face mask can be a danger. They are protective of the people in the environment around you, but they actually make things worse for yourself. And the reason they can make things worse for yourself, if you are positive and you're ignoring the signs and you're thinking, oh, I'll put on my face mask, I'll go shopping, what you're doing, or I'll go exercising, go for a run, whatever it is, you'll get rid of it, but you exercise, that won't happen. What will happen is the virus which you're excreting will be caught on the inside of the mask in droplets if you're coughing, and those droplets then will eventually dry out, and the air which is coming back in will eventually bring those in, and you'll be inhaling them. And now if you're inhaling them, they're going all the way down your bronchial tree, down to that alveolus and those around them. So you're actually getting not only the infective dose which you've already got, which you've caught, you're now getting superimposed infections. And as you get a dose increasing, the dose can eventually become a fatal dose. So if you think you've got the virus, don't put on a face mask, stay at home and start to manage it by very strict isolation from everywhere else. The next thing which you have to do at home is to make sure that the room is sterile, and there are various ways you can do that. You can do that by vacuum cleaners, particularly those which use a liquid. So if you're washing it, the same as washing your hands, if your air is being sucked up through a liquid, it will be clean. The viruses will be kept in there. Problem there is you can have viral particles which are moist in groups, and those you don't want to have to inhale as well. So at the same time as running a vacuum cleaner with water, if you run an air conditioner which is cooling it down, or just a dehumidifier which is even cheaper to run, it will take moisture out of the air. So if you've got water being taken out near where you are and further away in the room, you've got it being moisturized, you are going to breathe in air which is going to have very little viruses in it, and you don't really need to wear the face mask. But you do have a problem for people who are coming to look after you, and we have a problem in the hospital. And in the hospital we have exactly the same problem, because there we can have people who are looking after you who don't know that they've caught it yet. There's a period before the person becomes symptomatic, and during that period he is going to still be producing viruses, and those viruses will be building up into him, and he will be breathing them in again because he's put on the face mask so that he can look after you, and he's actually harming himself. So we've had a high death rate amongst people, HCPs, nurses, doctors, people who are working there looking after you. A lot of them have died, and some of them were friends of mine. So we need to make sure that this does not happen. We need to have a good look at what we're doing, particularly what we're doing in hospitals. We must be able to diagnose coronavirus infection very early on, and there are ways in which we can do that, which I'll discuss with you later. But at the moment we're going to have a look at this face mask. Face masks are important. They are decreasing spread, they have decreased spread, and they will continue to do that. But you need to make sure that you're not positive if you're going to put it on, and don't go out with it on. If you don't wear a face mask out, the police will stop you and you'll be tested, and if you're then found to be spreading it around, that is got very severe consequences, because you will be in fact killing people. And although you might not be charged with murder, you could easily be charged with negligence, recklessness, and things which have a 10-year prison sentence as well. So please use your face masks when you think you are healthy, all right? When you think you're not healthy, got any sign of it, stay at home and get people to come and test you properly, and they will be wearing face masks, and then we'll come on to ways in which you can test it earlier. So let's start back again now with in your alveoli here. You've got your virus has got into the alveolus, and it's now starting to replicate. Now what a lot of people understand about that is that, oh, that's simple, it just uses the DNA or the RNA, it covered its RNA, and then it can produce it from that. It doesn't need to produce anything more. Wrong. It can use it, that bit's right, all right, but it has got to synthesize every protein, every amino acid, the carbohydrates, the purines and pyrimidines, which are used for doing that. And that is why there's this asymptomatic phase. While this is all going on and they're producing multiple replicants, they have to do that in that alveolar cell. Okay? Type 2 alveolar cell. It's got to get it from the blood supply, or it's got to produce it. And there are various things which are needed for doing that. It is in fact is a parasite. And you know what happens with parasites. They live off you. You get hungry, you eat a lot, but you still can't keep up with it. You become thin. All right? And even when somebody becomes pregnant, they effectively have what is similar to a parasite. You have a baby, and this baby has got to grow. It's already got the DNA, the RNA structure from the gametes which formed it right at the very beginning, but these have all got to multiply, and so does this virus still have to multiply within this alveolar cell before it can get out. And in doing that, it produces waste products. And some of these waste products it can be identified with. There are some machines on the market now which you can use. They're not expensive. You can buy them, and it's certainly not expensive compared to the cost it's going to be involved with if you do catch the virus, because it hangs on for a long time afterwards and can be debilitated for a very long time, even if you don't die from it. So we need to look and see how we can do it early. And the earliest way in which you can see it is if you've got a pregnancy, the person gets given folic acid. And why do they get given folic acid? Because that's one of the things which is rate limiting. It's part of the single carbon cycle. And that single carbon cycle takes the carbon dioxide is one of them, some of the amino acids, joins these together, and that all gets built together. It takes a lot of energy, it takes carbohydrate, it breaks down, it uses a pentose phosphate shunt, which is just a different way to the normal way we do it, and produces different things. It produces DPH instead of DH. That is complicated biochemistry, but it's not all that complicated. It's fairly simple. You're just using the energy from sugars, which has come from sunlight, and you're using those to build these things which has created intelligent life on our planet. And that is this DNA, this RNA, which gets replicated and which we are gradually becoming more and more intelligent and should be able to overcome simple viruses, because they are not in control of their destiny. We are in control of our destiny. So we can kill it, and we can kill it. The best way initially is to kill it when it leaves you. All right. Now, as we talked about earlier on, killing it with a mask, it gets filtered out but gets caught there. Now, I used to be a scuba diver. I suppose I'm still qualified as one, but it's a long time since I went snorkeling or scuba diving. Now, if you were to put on a mask here, this would go over your nose, okay? Now, in scuba diving, we breathe in through a snorkel. This is a snorkel here, which goes to oxygen tank on your back, and with this goes into your mouth, like that, and then put a tap, and this will come through here. Below water, you use various types of sign language to communicate with one another. But if we were to put on this is used to keep water out. We can breathe and we can live with water around us. Now what we need to do when we're not sure about the virus being around us is we need to use the same procedures like that. We need to be able to breathe in through our mouth and out through our nose, all right? And both ways we need to pass the solution which we're breathing through more than just a filter. We need to produce it, take it through something which it can bubble through, where it can go through water, for example. It will be washed out into water if it went through, just as I'd mentioned with the vacuum cleaners. And the same when you're breathing out to keep your atmospheric closed, it can go through that, all right? But we did mention one thing, that water is called droplets, and you don't want to be making droplets because that will have the virus concentration in it higher. Now, one of the ways in which that can be done is, instead of using a snorkel and a face mask, is to use something which there is a mouthwash on the market which is biphasic, which people use to clean their teeth in the morning and afterwards. And what that does is that lifts bacteria which are strongly bound to the teeth, and that is strongly bound, and that's why it was originally invented, because it was able to loosen these bacteria off what was strongly bound to it because of its diphasic action. In other words, it had things which are like soaps, all right? They're hydrophobic, And the hydrophobic, the bond which you've got between the virus and the alveolar cell, that's a hydrophobic bond. And that's on the end of this corona, these little projections which are coming out from the virus. And that's all that's holding it on there. If you produce a hydrophobic soap, like a surfactant, at there, and attach the viruses to it, so their coronae are coated with something which prevents it from attaching there, then you can prevent it from doing that. So what I suggest is that we use things, the mouthwash you can't swallow, you have to spit it out, but it's still excellent. And if you buy some of that, it is also going to clean the air between your nose and your mouth before it gets down into the lungs, and it's supposed to work for 12 hours. A lot of this is research, still needs to be done, it still needs to be validated, but it sounds reasonable that if you cleaned your mouth with that, and it does have things in it like fluoride, which kills off viruses, and some of the other things which it has present are also virucidal. So that would be creating a barrier between your nose and your mouth and your lungs, all right? So you've already now decreased your bronchial tree because you've got rid of the space in the nose and the mouth, which is quite a large space, and you've got less going down from below the larynx, going down into the bronchi and down. But we need to clean that out as well. So we need to really, to get to that, we need to have air being circulated around, which is clean air. Because when you breathe in, when you exhale, you get the viruses out, but you don't get them all out because you have it called a dead space. That's a space which still got viruses in it, and you breathe that in again when you inhale. So that goes into newer alveoli. You want to stop that, all right? So if we've got air flowing quite rapidly through your mouth, out through your nose, and it's just being filtered so there's no viruses going into the community, by the filtration going out, and by the filtration coming in, there's nothing coming into you. You will wash and you will decrease that. Now, as we mentioned, that there's this period when you're asymptomatic, and that period is because this virus is having to grow, it's having to produce and synthesize all these proteins and nucleic acids which it needs to produce before it can eventually lyse the cell and then go out. Now that period is the period in which we really need to get to it, and we need to kill it, all right? Now if we know earlier on, and we can know earlier on because there are things which are liberated during this synthetic process, and one of the main ones of those is formaldehyde. Now formaldehyde, you can buy little bits of apparatus which are not that expensive, and you can measure in the morning how much formaldehyde you've got, how much formaldehyde you've got in your rooms, and that will tell you, all right, whether you are producing formaldehyde and whether there's some abnormal synthesis going on. Now that could be an ordinary RMA virus which is not COVID. It can be various other things. It can even be a malignancy or a cancer. Okay, but those cancers are not just going to start and then go away, which would happen with an ordinary RNA head cold, and it's going to stay there and it's going to start building up. Then the chances are you've got COVID, okay? And if you've got COVID-19, you need to be seen, and we need to be addressing that as soon as possible, because there are things which we can do about it. As we said, you can take things now, and one of the things which I think is a good idea is what you all know about is coconut oil. Now coconut oil is very similar to Q20, which you all know about. We spray it on engines, and it's part of this mouthwash which we use, and it's licensed, but it's only licensed to be spat out. It's not something which you can eat, which can go inside you. All right. Now if you take some olive oil and you swallow that, and you look at your skin, if you've got a particularly dry skin like I have, all right, and it's got dry, and you take some coconut oil, all right, within a few hours your skin's become shiny, like my skin's quite shiny. That's because it's oily on the outside. So that oil isn't harmed you. That oil has got in, and it will go throughout your body, and it will also go to the lungs. If it's going to the lungs, it should be, I hypothesize, making it more difficult for the virus to spread or to attach once it is spread. And if you're breathing in through a mixture of water and coconut oil, and that I have done here and had a look at it. That is cocoa cream, what it looks like, which I bought, and that, as you can see, is a whitish cream. If you can look down there, it does break down and separates, and there's still some water in it, which is coconut water, which is more hydrophilic, whereas this is hydrophobic. And now if you look at this one here, this is where I added some water to it. Okay, that same cream, and you can see there's a layer down at the bottom here. But what else can you see is you can look at the top here, you can see that it's attaching to the glass. Alright, it's hydrophobic. So it's doing exactly the same as what it will be doing to those viruses and to the alveoli. It is working as a surfactant and it is attaching to the glass. If you look at one which I heated up in a microwave oven and then let it, you can see here how it has formed clumps within it, and then it has spread up all around the sides of the glass there where it is stuck to the glass. Alright, so it's got those properties which we need to try and build up our resistance, as well as it's being a food, of course, and a non-toxic. Alright, you've got to be careful that you aren't allergic. Some people are allergic to nuts, and if a person is allergic to nuts, you need to be careful that you aren't allergic to coconut oil. If you're not allergic to coconut oil, then I suggest that you try a little bit. I know that it's really hard to get in the shops, but I think there should be some control so that we do get what we can get there. Once it has got into and you come into the hospital environment should be a lot stricter than I think it has been on face masks, and we should be testing people earlier when they are working there, before they put on the face mask on, before they go on duty. They should be tested to see what the level of formaldehyde is which they've got in them, and if that is raised, they should be off duty. Okay, because they are making it worse for themselves there. Somebody else has to do the job for them in the meantime. It sounds hard, but it is far worse for them to catch it, because they are going throughout that period of the asymptomatic period. They are breathing it in, and they're not only getting to the infective dose, which they will have reached once they're producing formaldehyde, they're above the infective dose, they will be getting a lethal dose. In other words, they were getting a large quantity coming into them with a very short period of time. And that is why probably we've had so many deaths amongst people who've been trying to help us, who've been trying to, first-line workers, who I've worked with all my life for 66 years, and I feel very sorry for them. They're brave people, they do what's their duty, but we've got to protect them, and we've got to make sure that they are not in this asymptomatic phase when they go on duty, because that is hazards. We have an advanced life support, we call it HABC, and the first thing is hazards. If it's dangerous, you don't do it. You sort out the danger first, because if you don't, you become part of the problem and not a solution to the problem. So they need to be looked after as well. There are other people can take over from them, and if we take it upon ourselves, individuals, to start looking after ourselves, our family, we eventually look after society as well. So we need to buy this little bit of equipment, not that expensive. Test your formaldehyde every day, and if you do have to go out, you must make sure you're not got a raised formaldehyde expiration, and then put on a face mask, because then you are also protecting yourself from getting it from somebody else. Alright, and you've already made sure that even if you were in the early stage where you would have not so much being excreted as virus, we don't know yet when formaldehyde is how early it shows itself, but before the formaldehyde is there, it would be a period when you're still infected or still excreting viruses, so they are still producing viruses, okay? But that can be managed in the hospitals. They've got intensive cares, they've got everything there. And they've also got extracorporeal oxygenation, so we're not entirely dependent only on respiration. And if respiration is the problem and spreading it, then perhaps we should be using extracorporeal oxygenation earlier on and decreasing the amount of respiration and not getting to the stage where we're trying to excrete it all right, by letting the alveoli collapse. Because once an alveoli collapses, it's not going to open up until it gets a surfactant in there which will allow it to open up again. All right, and if you get, instead of a positive pressure respiration, we probably need negative pressure respiration. So air is coming in through the mouth, out through the nose on a one-way thing, clean before it comes in, clean before it goes out, and it'll be wafting out whatever comes with a minor degree of movement from the lungs and the alveoli to push these out of the alveoli and out of the person entirely. There are also other things which are available to them now. We've always said that antibiotics don't work on viruses. Well, they don't. In a head cold, they make very little difference at all. But in something which is going to kill you and is going to be there for a long time, there is a role for antibiotics as well. First, in preventing secondary infections where there are bacteria around, and also a lot of these antibiotics also work on the replicating system, which is the system which we are using in the lung and the alveoli to produce these foreign invading viruses, all right? So using antibiotics at that system within the cell, all right, they can work there as well. So there's a lot we've got to understand, there's a lot we've got to understand, but I think I've explained quite a lot of it to you at the moment, and I hope that it will eventually play a bit of my role, although after 66 years I think I've already played most of my role, but I would like to have a little bit of a sprint towards the end and hope this will achieve some success. But it does need to be not only proven, it also needs to be validated. And validation means not replication. Replication is replication. It means showing by a different method. And there are lots of different methods by which everything I've said can be shown, all right? And if any of those validated, then that is what we should be doing. But that is up to people who are actually manage them. As I say, I am not managing patients at the moment, except in screening role, because I myself am 81 years old, so am effectively in lockdown. I don't think my immune system, although it's been served me very well for a very long period of time, it will eventually start to pack in. And I think younger people have got a much better chance of doing it properly, and I hope that I'm able to help them in their role. They're indeed very brave people. I've known lots of them, and they are stars. Thank you very much indeed for listening to me, and I hope you found it helpful. Thank you. Bye.